Thank you very much for coming here today. We really appreciate it. We would like you to briefly explain to all the patients out there who have a missing tooth, how can an implant treatment be a better solution than any other treatment?
So there are basically 4 treatment options. The first option would be to actually just leave it alone, but then that would be a gap and it's not very aesthetic. The second option is to wear a denture, but that's again not permanent. It's a plastic solution or a metal solution. You take the tooth in and out, and it's actually not something that's permanent. The third option is actually to do a bridge where you cut down the 2 adjacent teeth next to the missing tooth, and then we put a tooth over there and we put everything in on the same time. So this would be a bridge. But the disadvantage of that is that you would have to cut down the 2 teeth, and it links up as a whole unit, and if anything fails in the future, everything fails at the same time. So what would be good is to leave the empty space as an independent unit. We can actually put a titanium rod, and we can come in over here and screw in an abutment. So we leave these 2 teeth alone and they're in their pristine position, and you can come back in and restore this part with a single tooth. So to me, this is the best solution because it is independent, it doesn't affect anything else in the mouth, and it's strong and healthy.
Is it true that patients with compromised health like diabetes, osteoporosis, or even heavy smokers have higher risk for implant failure?
Yes, definitely. There are 2 categories of patients. In the middle spectrum where it's not so bad, and another spectrum where it's very severe. And in this severe category, we have people with uncontrolled diabetes, people who have very severe osteoporosis and who are on bisphosphonates. And we also have very heavy smokers who smoke 1 to 2 packs a day. Now, in this severe category, I don't even think implants should be placed in them because the risk of failure is so high. But we do have a middle category where the diabetes is controlled, people with slight osteoporosis, not on medication like bisphosphonates, and we also have the light smokers. Now, in this category of patients, even though they have a slightly higher risk of osteoporosis already, it is actually possible to stabilize an implant fixture in this stable and porous bone.
How do you manage this situation in your private practice?
So in this situation, I like to use the Straumann SL Active because this SL Active surface is actually hydrophilic. It draws blood towards it and a very stable blood clot forms. So it actually shows that the secondary stability is actually better because of accelerated cell and bone healing. And with this better bone healing, I have more confidence that while the implant is osseointegrating, the implant fixture is not going to move around while the patient is healing.
We also know that you do implant treatment in patients with bruxism. How has Straumann helped you there?
So for bruxism, it used to be a contraindication because these patients have excessive load on the implants. But to me, nowadays, if you can take care of bruxism by giving botulinum toxin injections to the masseters, and these patients are not able to clamp and grind so hard, if you are able to take care of those excessive forces, then yes, you can continue to place an implant. At the same time, sometimes after a few months when the botulinum toxin injections actually wear out, you can get increased forces again starting to come back. But then if you place a very strong implant, like say for example the Straumann Rock Solid, then we are able to continue with implant placement. And why is Rock Solid better? Rock Solid to me is actually made out of titanium and zirconium, so it's actually been shown to have higher tensile strength and compressive strength. So even if the forces are slightly heavier than normal, then we're not worried about this implant actually shattering and breaking on us. So I do feel more confident when I go ahead and place this implant.
A beautiful smile is in high demand, and perhaps today more than ever. They say you're never fully dressed if you don't wear a smile. Can you tell us how you restore aesthetic and confidence in your patient with dental implants?
So when someone needs a dental implant, you definitely want this implant to look very natural and harmonious with the rest of your teeth. It's very important as a clinician to give you a good shade, a good shape, and also the gums framing the implant must look really nice in the sense that it must look pink. Now, the problem with dental implants is that when you put that dental implant fixture in, this titanium is actually gray. So if the bone is very thin or if this implant fixture is too fat, you will see this gray sheen. So we do want the implant to go as narrow as possible, and yet it must be strong. So I like to use the rock solid in this case so that it's still strong while we're able to put bone and gums in front of it to hide that gray sheen. After you put the implant fixture in, there is usually a healing period for this implant to stick to your bone. And during this period, you have to wear a denture, and this denture is actually removable. So at night, you actually have to take it off before you go to sleep. But with the new protocol, what we do now is sometimes if you're healthy and your bone is good, we are able to put that implant fixture in and put a temporary tooth on top of that implant fixture on the very same day. So you never have to go without a tooth and you never have to go without a smile. So if you're a woman and you don't want to go to sleep without your tooth in front, then I would say this protocol may be very suitable for you.
You have mentioned that immediate protocols have helped your patient with missing tooth in the aesthetic zone. Can you tell us more about it? Have you used the BLX system?
Yes, I use the BLX system and I love it for the immediate function and the protocols. What happens when someone comes in with a tooth that needs to be extracted is that after we extract that tooth, we use that very same socket to put that implant fixture in. And because the BLX is shaped such that there are a lot of fins, these fins can actually stick out from the implant and grip the palatal bone, so the implant itself is very stable. Now with that stability, we are able to put a temporary tooth that's hooked onto that implant on that very same day. So when you go back at night and you face your partner, you never have to remove it just before you go to sleep at night, which is, I think, a much more sensible option and a nicer option.